welcome everybody to what is now week 6 of the Cecil Gibb's research seminar series. So I'll hand over to Michaela and then we'll hear from Connell in terms of introducing our fabulous speaker for today. So Michaela, over to you.
Hi everyone, thanks for joining the psychology seminar series. Just a few housekeeping rules. Just a reminder that this seminar is being recorded and will be available on the psychology YouTube playlist. Questions are welcomed and can be asked via the Q&A function or by raising your hand. If you raise your hand, you'll be invited to unmute yourself and ask your question. Thank you for your attention, and I'll now hand off to our theme convener, Connell.
Hello everyone, and I feel absolutely privileged to be able to introduce today's speaker, Dr. Greenwood, who is a postdoctoral researcher here at the Australian National University, the Research School of Psychology here. Dr. Greenwood, I guess, has quite a broad range of interests, including the neurocognitive mechanisms of psychosis and behaviour change, particularly with substance and behavioural addictions. Dr. Greenwood has also been involved in randomised controlled trials for behavioural and pharmacological interventions, and is currently working on longitudinal research on neuronal signatures associated with cannabis use disorders. However, today, Dr. Greenwood will be providing an overview of something a little bit different on the Australian National Bushfire Health and Wellbeing Survey, which has really focused on so many important areas of recovery, such as social connectiveness and resilience, which have all become so important since the 2020 bushfires. So I'd like everyone to please join me in welcoming Dr. Greenwood to today's Health and Wellbeing seminar.
Thanks, Connell. Thanks, Michaela. Yeah, so as Connell mentioned, I do have a bit of a diverse research background, but this research project that I'll talk about today is I guess funded by or supported by quite an interdisciplinary and multidisciplinary team. So that will make a lot more sense when we go through the different aspects of the study. But before I begin, I did just want to point out that the talk does contain some visual images of bushfires. And because this is a bit more of a perspective talk rather than talking about the results of the study that's ongoing, I do talk about some of the constructs, and I do use quite a few quotes from participants that have shared their lived experiences and participated in the survey so far. So please just do keep that in mind, and if anyone would prefer to talk about the research at another time, just reach out and I'd be more than happy to meet with you. But today I'm going to give you a bit of an overview of the survey. As I mentioned, it's ongoing. We currently have it underway, and it's called the Australian National Bushfire Health and Wellbeing Survey. I'm just going to share my screen with you now, so I forgot to do that. Okay. So the context of this research was the 2019 and 2020 bushfires. So these fires were quite unprecedented in their scope and scale. And if we just look at some of the statistics from New South Wales alone, there were over 11,500 fire incidents, and their scale was further captured by the land that was burnt. So 5.5 million hectares, and nearly 2,500 homes were destroyed. But what's also significant is that across the state, I think it's about 26 people were recorded to have lost their lives. But if we actually start to look at the secondary effects of bushfires on mortality rates, that number does continue to grow. So bushfires have always been a feature of the Australian natural environment, and unfortunately we continue to face many challenges during post-fire recovery. And one of the more pervasive problems being the long-term mental health impacts. So in response to these bushfires, our quite diverse team designed a program of research which we titled Building Resilience to Promote Mental Health in Bushfire Affected Communities. So the research is funded by the Medical Research Future Fund's priority research area for the mental health impacts of bushfire on affected communities. And this is where I'm quite grateful to have so many people supporting this research, and also who gave quite diverse and dynamic views in the design of the first project, which is the survey. So the team spans across the ANU's Research School of Psychology, the Research School of Population Health, and the ANU Medical School. And we're also supported by Professor Nagesh Pai. He's a practicing psychiatrist and research professor for the medical school at the University of Wollongong, and also Dr. Tim Kurz, who is a social psychology researcher and senior lecturer in the School of Psychological Sciences at the University of Western Australia. But much of the, I call it challenging work that's been done so far is by our research team. So Dr. Emily McLeod is a clinical psychologist, so she's bringing some great perspectives to our research program, and she's the postdoctoral research fellow coordinating this series of projects. And then we've also got the soon-to-be Dr. Timothy Haffanen. He is working remotely at the moment, but he's extremely hardworking, has been quite critical to some of the work that I'll present today. And he's also currently completing his PhD externally as well. But I'd like to just start by giving a bit of context to our strategic research goals. So just some of you might not be familiar with this area, so I'll keep it quite short, but just to provide that bit of context. In 2015, Australia adopted a national risk reduction framework in response to national disaster. So as a nation, we implemented the international Sendai framework. So this was an international initiative to respond to disaster recovery processes across the world. And it has strategic goals which extend to 2030. So in 2017, 2 years later, after the framework, the Australian government established the National Resilience Task Force within the Department of Home Affairs to really help us respond to national disaster preparedness. So when we had this government response, it really spoke to the value of a national level understanding of disaster risk and what that means for people and communities. So the national framework supports investment in resilience strategies across not only all levels of government, but across broader societal initiatives as well. And this position was really reflected in one of the opening statements of the framework. And that is that as Australians see the growing potential for natural hazards to trigger devastating disasters, we rightfully expect that all sectors of society will work together to limit these impacts. And one of the drivers of this framework that we kind of took hold of is that the disaster impacts are long-term and complex. So the framework directly recognises the long-term challenges and impacts of physical and mental health and well-being, and also how these can impact a person's ability to prepare for disaster, but also to respond and recover. And the framework also acknowledged that data consistency was really essential to facilitating those kind of decision-making processes. And so we really wanted to try and hold on to that acknowledgement and importance of data consistency when we made some decisions throughout the different types of measures to include in our survey. And the framework also acknowledged that the use of national data sets wherever possible really helps to ensure that we have some agreed definitions and different types of methods so that we can compare not only across communities, but also different types of natural disaster and across time as well as our community structures and individual needs change. So we really did try to focus on that and the implementation of where these results would contribute to. That's always quite difficult when you're challenging research questions versus its application. But the first strategic aim of the research was to inform the long-term risk factors of psychological ill health and to promote resilience in bushfire and also smoke-affected communities. So the research is looking at long-term effects of bushfire on mental health. So research has consistently shown that a minority of individuals affected by bushfire disaster experience quite significant long-term mental health problems. And these can persist for many months, years after the disaster. And unfortunately, some people actually don't quite fully recover. So in response to the bushfires, there was an unprecedented amount of money that was raised, both by the public and also state and federal governments that were promising funding and resources to support this bushfire recovery, not only immediate recovery, but long-term. And this included support for mental and physical health. But some of you might recall there were some pretty interesting media articles at the end of 2020 that more than half the money that was promised actually remains unspent. So as a research team, we wanted to know what life looks like for individuals across Australia right now, and hope to inform some of these resources should be continuing to be contributed. So the survey that we've designed is just the first stage of the research, and it aims to understand people's lived experience with bushfire and also bushfire smoke, and how their relationship changes in terms of their physical and mental health, but also their lifestyle and their connection to community and land. So these are some of the factors that I'll go over when we talk about the structure of the survey. So when we think about the effects of a bushfire from a practical perspective, it really makes quite a lot of sense to sort people into categories based on the exposure of the disaster. So we tend to ask questions such as, did you lose your home? Did you have fire on your property? Did you lose possessions that were important to you? And while these things can be really important in understanding exposure and directing financial resources that can be spent, we really do, particularly in our field of research, need to be careful that we don't assume that those who answer no to these kinds of categorical questions are unaffected by the bushfire. So if we think about a local sort of community level of bushfire impacts, it affects the whole community. So whether an individual has direct experience with the flames of bushfire or not. So it might be that people's properties have not been damaged, but maybe they felt as though their lives were threatened. Or people can be exposed to the secondary effects of bushfire, so things like smoke, or even returning to a site that's undergoing recovery. Or it might actually be that people are experiencing distress vicariously. So a common example of that one that's used in the literature is survivor's guilt. So someone's home might not have been damaged. Maybe, hopefully, they've actually evacuated the area before the threat of a bushfire arose. But that kind of guilt can occur as they see their neighbours and other members of the community where their homes have been destroyed. So they experience vicarious distress from others in their community. And what's really interesting in some of the feedback from participants in this survey is that we don't just see that as an effect within communities, we also see that as an effect at a national level. So these are some quotes from participants that have replied to this area of research. So we can see that impacts to community, so this person has basically said that impacts to immediate friends in directly affected areas, so example, coastal and in emergency support roles, impacted them vicariously. So they're acknowledging this relationship quite directly. Another person said that this has been a big talking point, that many of us who have been directly impacted by the fires have nevertheless had trauma response and are still experiencing these effects. So this one also acknowledges that vicarious distress can extend over time. And so that's why we're also looking at these long-term impacts. This one, quite detailed, quite emotional to read as well. My best friend was defending her home on the coast and ready to shelter in her dam with her 2 young children. Then I lost contact for 48 hours. These were the things that impacted on my mental health, less so than what was happening directly around my home, even though we were on watch and act. It was more about the unknown aspect for people I loved in other places. And so this is something that we're also trying to capture in the survey, and not just focusing directly on bushfire affected communities, but we're also extending that to smoke affected communities and non-affected communities, and looking at how these experiences are still impacting people's lives. If we look at some of the statistics just of the data that we've collected so far, so we've had just over 700 responses, we can see that 240 people, which is about 1/3, lived in bushfire affected regions during that time. And so that's quite a high number that we have in terms of the response rates so far. But what we also found interesting was that 162 people were an employee or a volunteer of an agency, organisation or private business that provided emergency response services. So these people might not actually have direct exposure to the actual fires if they weren't defending the fires directly, but also in the recovery efforts. So they're seeing that, that post experience. So I'll talk at the end of the study, at the end of the talk about some of our recruitment strategies and how we're trying to make sure that we cover each of those different kinds of categories. But although the effects of bushfire can be quite widespread, something else that we need to be careful about, and we tried to do in this survey design, was trying not to prescribe a single identity to a whole community. So the effects of bushfire, and this speaks more broadly to other natural disasters, belong to the person experiencing it. So for the same two individuals, they may be exposed to the same natural disaster, but it can be perceived quite differently. So for the rest of the talk, I'm going to go over some of the primary outcomes that we've tried to achieve in the survey. And just keeping in mind that these are in addition to the more typical questions about bushfire exposure and those kind of categorizations that I talked about earlier. But I'll try to give you some kind of understanding of our decision-making process and how we conceptualized their role in understanding the long-term mental health outcomes. So if we look at the area of mental health, we really focused on psychological distress. So natural disaster often results in a more immediate and short-term experience of really intense physical and psychological reactions. And these reactions can be quite important because they help us to respond to the situation by conserving our energy and directing our energy towards keeping ourselves and others safe. So it helps us to navigate that short-term decision-making process. But research has also shown that for many people, these intense physical reactions will actually reduce over time, and the daily challenges that prevent healthy functioning become more and more manageable. So these individuals will gradually regain a sense of control over the aspects of daily life to support their recovery. But unfortunately, there are others who continue to experience that distress and mental health problems for quite a long time, even years after the fires. What we found interesting was that in the disaster literature, the concept of psychological distress is measured quite differently, and the most common being a general measure of distress that encompasses some anxiety and some depression symptoms. But distress can be experienced in many ways. So it can include symptoms of generalized perceived stress into our daily life. It can include symptoms of post-traumatic stress disorder, which was also another common measure. But it can also include things like anger, which can result from a lack of control and is also part of the grief process. One that we actually found kept cropping up in some of the comments, so we're quite lucky we included this one, was worry. And this can transition from the unknown immediate threats at the time of a bushfire, and it can continue into the uncertainty of not knowing about what their recovery process will look like, not knowing the timeframes, not knowing how they're going to be able to access resources in the future. And there's also an increased risk of psychotic experiences following a traumatic event. So this was another unique area that we decided to look at in this survey. And also bereavement in terms of loss, but loss to life, also to property and possessions. And you can also see that it makes sense to look at concepts like self-esteem, given that loss of control over day-to-day life. And that can have some compounding effects on psychological distress. So over on the left-hand side of the screen, you can see another quote from one of our volunteer participants. "My experience with the bushfire was worry. I was concerned the bush behind our new home would go up in flames." And we started to see that theme crop up more and more. And if we look at the concept of resilience, so this word resilience is really what frames a lot of our national strategies, a lot of our funding programs. And in the context of mental health resilience, it really comprises the different thoughts and behaviours that promote well-being and protect against those poor outcomes for different physical, social and emotional areas. So it's thought that individuals who are highly resilient to natural disaster are able to cope with and recover from the negative events. And we found that within the literature, it's common to conceptualise resilience as just the absence of poor mental health, or as the ability to really bounce back after an event, so to being able to return to life as it was before the disaster. But instead, if we think about some of the diverse ways in which people respond, we can think about coping in different ways. So for some, they may respond by just reacting to the event. They may have just a generalised ability to somewhat cope with what is happening and get through day-to-day life. Or it might be that they're adapting to the circumstances, as I mentioned before. So this is where they really find new ways of maintaining their functioning. So they look at internal and external resources. But there actually may be situations where people can go beyond that. They can actually transform following the experience. So they can grow from that experience. And that's obviously the most desired outcome if we can have a positive directory. So negative outcomes really are not inevitable, but we do need to understand a lot more about those factors that mediate a positive transformation. So in this area of the research, we're looking at the concept of resilient coping, using a brief resilient coping scale. We're looking at quality of life, and we're also including a post-traumatic growth scale. So you can see that now we've kind of got the angle of distress, but also that positive side of resilience in terms of growth. But if we sort of take an even further step back, we can also use those fundamental building blocks of psychology to frame different kinds of emotional response to bushfire, as well as the different kinds of coping mechanisms. So in your kind of more kind of cognitive behavioural model, we can look at cognitive responses, emotional responses that elicit feelings, the physical response of the body, and then the behavioural response which influences our actions. So we think about someone who kind of has an anxious response, sort of from a sort of distressing perspective. The thought might include asking sort of, what if this happens, or what if this did happen in the past? So that's that worry that we talked about earlier. And then the feeling would be something like anxiousness. The body might be really, really tense, and the behaviour, or which turns into an action, might be avoidance and motivation to move away from the recovery process. But if someone has a more optimistic thinking style in response to the event, the thoughts might include something like, I can find a creative way to get through this. So they're more likely to act and engage in the recovery process, and their body will be calmer, and motivation to really get in and confront the event would be much stronger. So to better understand these processes, which could be really driving some of the kinds of resilient coping that are typically measured, we decided to look at broader concepts of coping styles, but making sure that they're actually anchored to the event. So this also helped us to exclude some confounds like COVID if we looked at generalised coping styles. So we used a brief version of the COPE inventory, and we have people responding to how they feel as though they're coping or performing those behaviours in relation to the bushfire experiences. And then if we think about resilience and including how individuals cope with and make sense of bushfires, this kind of construct is really influenced by a variety of social, cultural and different economic and financial factors. And these all interconnect with the structures and attributes of community groups. So social connectedness and community resilience are really important in facilitating recovery from bushfire. So dramatic changes to the environment and our social landscape following bushfires means that community structures can become quite fragmented and displaced. And so access to these usual resources and physical connectedness can be disrupted. And this is something that can really lead to a sense of isolation and loneliness. So the direct links of how this could impact psychological distress can be quite clear. However, there's a lot of international research that also suggests that disasters can really facilitate the emergence of a shared identity and solidarity, particularly with fellow survivors from within a community. And so this could actually in turn make cooperation and resilience and even that concept of post-traumatic growth a lot more likely. So we want to kind of understand people's sense of social connectedness. So we looked at a measure of social connectedness, community solidarity, even a membership scale, and concepts of loneliness. And you can see that this, what was really interesting is when we've looked at this in a survey, we've actually seen this fed back in some of the comments as well. So again, on the left-hand side, you can see that one of our participants said that the bushfires will affect me for the rest of my life. The most devastating aspect was the feeling of being forgotten, except by local people. So it's quite easy to infer from that quote, the importance of that sense of belonging to their local community must have had in terms of the effect of the bushfires on that person. Something else that we wanted to look at was how people respond to communities in terms of the way in which they look before and after a bushfire. Sometimes they can be irreconcilable. So it can look completely different. And that lack of solace from the environment can cause significant stress and grief. It can be re-experienced upon return to the environment after the disaster's been removed. And so we also talked earlier about vicarious distress and bereavement. And so we've also asked about grief associated with loss of wildlife as well. Something that I always think about when we do this area of research is a news article at the start of the recovery process last year. It was around the middle of 2020. And there was a lady on the news who talked about her conflicting emotions. She was really excited that the recovery process was underway and her home was being rebuilt, but she also had this sense of worry that it wasn't going to feel like her home. The landscape and the community was still quite devastated. And so she had those kind of conflicting emotions there. This quote that's on the screen at the moment was in a bit of a broader context, which leads into some of the political affiliations and climate change that I'll talk about in a moment. But they basically said that the continual repetition of pictures of fire and burnt animals have been extreme, but the river was dry for most of 2019 and 2020. So they're looking at the stress of drought as well. So they said that wildlife were dying in paddocks due to a lack of water and feed. The koalas in our area have disappeared. We no longer see kangaroos in the paddock. So you can see that these are at the forefront of people's minds and what's actually changing and happening within the environment due to different types of natural disaster. We also wanted to include different areas of attitudes and some broader concepts that I've included under this heading. So when we broaden our scope and definition of psychological distress to include anger and a lack of control over the recovery process, and then it becomes really important not only to consider the financial resources that are available, but also how these can sometimes negatively impact recovery. So if we think about donations which come flooding in after a disastrous event, some people are not well positioned to actually receive those donations. So they might not have space to store them. They might not have the transport to get to the drop-off centres to pick them up. Maybe they're focused on immediate care for themselves or some others. So maybe medical care is the priority at the moment. And this can create quite a lot of stress if they actually take the donations, but don't have places to put them or to use them. But then on the reverse end, it can also create a lot of worry and stress that they're going to miss out on what they really need and that it'll no longer be available. So it might seem straightforward, but the way in which people are able to engage in those processes that we implement are also really important. And what we've seen in response to the survey is that insurance processes and a lack of money and navigating the challenging processes to access those funds has contributed to stress and overwhelm. So the Royal Commission report described a really extensive list of financial support services. So you might have heard of some of those. So they were loans, concessions and grants, different kinds of government allowances. I think there were even payments for charity supports and different kinds of vouchers. But this doesn't mean that it was readily accessible to everybody. So when we talk about earlier about our body's automatic stress response to a disaster, we mentioned that it can help us to direct resources to keep us safe in that immediate situation. But when this stress response continues after the immediate threat is gone, it can actually disrupt our memory processes, our ability to concentrate. And you can imagine how difficult this would be in the best of times to kind of navigate some of the different financial avenues without these additional difficulties. So one of our participants has said that the ecological consequences far outweigh any social consequences, and this adds a high degree of anxiety to me personally. And there they're talking about where the emphasis is placed. And somebody else said that she referred to being able to refer to her, she was referring to her insurance. And she said these sorts of pressures add to your mind. Why you have to protect your property because you cannot afford to pay for insurance. This is my home, this is my life, and this is where I have lived for 30 years. So a context of that person is that she felt as though she had to stay to protect her home. And then she also talked and gave us some of the figures about what it would cost to insure her home relative to other areas, and that she simply couldn't afford that. And then we also have somebody else, and this one's a quite interesting one in terms of engaging in the processes after recovery. So in the aftermath of the fires, I've been heavily involved in the grant application process. Working on these grants was the most traumatic aspect of the fires. It was more traumatic than attending the funerals of friends who lost their lives. It's more traumatic than viewing the utter devastation. More traumatic than defending our property through 9 emergency evacuation SMS alerts. So understanding that some of these processes, it's almost like experiencing a trauma after the actual trauma event. So in this study, we wanted to understand a little bit more about these experiences, some of the attitudes towards political affiliations, climate change, financial strain, and understand how they may be motivating some of the anger, worry, anxieties, those kind of psychological distress symptoms that we talked about, and potentially how they might be a barrier towards positive growth. This one was also, interesting. There's just one more. It shows you a little bit of a different angle of an attitude towards the funding expenditure. So this person was not a volunteer firefighter, but mentioned that they knew a lot of volunteers who were responding to the fires. And they said that I'm so beyond disappointed that our government rely on volunteers to fight these catastrophic fires with little support. They had to buy their own PPE. There should be an investigation into the millions of dollars donated to charities that have not reached most of the communities and individuals affected by the horrendous event, and that there's no clarity on where these monies are going. So it's that kind of unknown part of not being able to engage in the financial process. So we just put out some data at the moment to look at political party affiliation. Quite interesting. So nearly 40% do not affiliate with any political party, and we just named some of the popular ones there, but quite a high rate for the Greens. So it's not surprising given some of the avenues that we've used for recruitment so far, but also some of the regions that we've targeted. So we're hoping to spread that out a little bit in the next phase of recruitment. Then if we also think about practical ways of categorising bushfire, the same typically applies for preparedness. So we usually frame it in terms of physical and practical measures, but it's really important that we actually look at psychological preparedness as well. So we've included a psychological preparedness and disaster threat scale to really try to capture knowledge and awareness rather than just action which we typically see with our bushfire safety plans. I'll just keep in an eye on the time so that I can wrap up in a few minutes. I'll just move through this quite quickly, but I can come back to some of these if you have some questions. So something else that we've looked at, and I think that this research has been done really well across some of the schools already, but we're also looking at physical health. So we tried to look at what we can kind of contribute to the literature in terms of what's already being done. So in terms of physical health, there's a wonderful report that came out by the Asthma Foundation and extended the practical features of managing asthma in the event of a bushfire, and try to relate that to try to conceptualize that as a vulnerable group that's at increased risk of experiencing poor mental health due to those experiences that they have to undergo. And so we wanted to extend that area of research, and so we've included different kinds of questions that look at financial stress and strain in terms of being able to access different types of resources. And we've looked at that in two ways. We've looked at that in terms of resources that are actually available. So you might remember that a lot of different types of puffers just completely were cleared off of the shelves and difficult to access. People had difficulty in some regions accessing different types of air filters for their home and trying to make that a safe environment. But then also just in their own individual financial stress and being able to pay for all of those in what was an unpredictable event for them. With lifestyle behaviours, so I mentioned at the start of the talk that during a stress response, people have trouble prioritising their thoughts and their behaviours. And so the things that we normally do automatically take second place, and because they require extra energy now. And so they really do move down the priority list. So people can experience changes in sleep patterns. They can lose a sense of awareness about their body's physical reminders. So simple things that we usually do, like eating, sleeping, remembering to drink during the day. And these tend to then, as I mentioned, go into low motivation due to competing mental factors and low priority at the time. So they're usually routine. And we don't usually require our bodies to expend a lot of mental resources to achieve them. But I know that there's a few people listening to the talk at the moment who look at multiple behaviour change. And we know that in the best circumstances, it can be extremely difficult and at times very unsuccessful to look at long-term behaviour change. So if we look at these behaviours, so sleep, food intake, exercise, we looked at alcohol, tobacco, we even looked at cannabis use and gambling. And some of these behaviours can actually be a barrier to the transition from having an adaptive resilience response to one that's more of a transform and positive growth during the recovery process. There might also be barriers to potential mental health treatments and interventions. And what we're interested in looking at and doing some follow-up research with this survey over time is also that these behaviours then introduce new risk factors for these communities. So these types of behaviours are recognised by the World Health Organization as the highest risks of lifestyle behaviour for chronic disease. And so we felt as though this is something that we should tap into. So we ask about perceived importance of changing these behaviours, as well as people's motivation to change them at this point in time. So we want to look at how that motivation might change over their recovery. And this helps us to understand where they are as a priority for that person. So we also use a range of validated screening measures to scale their severity. So for example, we have some screens for the quantity and frequency and dependence of nicotine, alcohol, cannabis, and gambling. We also measure exercise using a brief standardized scale as well. And then we actually do try to capture some of the people's perceived changes and causes for that. So we do ask questions throughout in relation to whether they attribute these changes to COVID, how they were performing before the bushfires, immediately after, and long term as well. So some of these responses from participants, you can see that they're having ongoing breathing issues after the fires, even at this point in time. They're worried about how they'll cope physically once returning bushfire seasons occur. And then, okay, I'll try to wrap up now, but then we also looked at some additional stresses and the role of parents. So threats to oneself can also be extended to the threats and the associated experiences of the life of others that you feel a sense of responsibility for. So we ask about parents' perceptions of children's behaviours, using a standardised checklist of different childhood mental health disorders, where they actually attribute the changes to those behaviours, whether parents are attributing those as a response to the bushfire, response to COVID, or a response to both. And trying to understand some of the ongoing stresses that are in day-to-day life for parents that they're trying to cope with that result from the bushfires, not only in their own personal lives, but as the role of a parent as well. So some of the other things that we're measuring in this scale are also previous chronic illness, previous disabilities, previous bushfire exposure, COVID impact. We do have a COVID scale for stress impact associated with COVID, also financial strains associated with COVID. We also ask about access and uptake of mental health services at the time of the bushfires and also ongoing. So we've done a social media campaign. We have 700 responses so far. Last week, we've just sent out at the end of the week some community letters to quite a few regions. So we're expecting those numbers to significantly increase over the next week or so. We just started seeing the responses coming this morning. And we're also doing, looking to use a supplementary Qualtrics sample just to make sure that in case we need to pick up on some of the different regions or different age or demographic factors for the non-affected regions as well. So this survey really is just the first study, and then we're going to take some of those outcomes and do follow-up surveys with the same participants. We're also doing some follow-up interviews to look at some of the main outcomes in a bit more detail. And then there is a second phase of research, which I won't go into, but I thought it might just be nice to highlight to everyone where this research is going, particularly in case you want to be involved in any of these stages of research. So the second stage, which will start towards the end of this year, is to evaluate the preparedness of psychological health professionals, so not just individual members of communities, but also the health professionals, to deliver distress and psychological support for those communities. And we'll also look at their self-care strategies for their own mental health. And I thought this just might be a nice quote to finish on. Something else that we received back from a participant is that they would like to thank the fire department for saving their home and treating them with care. They were amazing. So thank you.
Great, thank you, Lisa. And for your talk and your update on your project and how it's all been going. And it's exciting that the data has come in, I think you're saying this morning, kind of very good timings. Unfortunately, we can't ask you to give us the updates on the analysis so far, but I'd just like to put it to anyone. We have a few minutes for some questions. So please let me know by raising your hand or typing in the question and answer, the chat box, if anyone has any questions for Dr. Greenwood.
There is a question in the Q&A box.
Okay, well, there's one question here that I'm happy to read out. Zoe was wondering if you had any thoughts or expectations or hypotheses on how social connectiveness might relate to solastalgia. Is that the correct pronunciation?
Solastalgia, yeah.
Solastalgia, oh, I was close. Do you see it as something that might undermine social connectiveness or resilience? Or might this be a shared collective experience that might even reinforce or underscore the importance of localized social connections?
Yeah, it's a really good question. I know that there's some people who are listening who will probably answer a little bit better than I can, but I think that what we've tried to measure, so it's an interesting question that I think hopefully we can answer a little bit more with the data, and I think that will probably be mediated by people's previous connection to their community and how that's actually changed. So we can kind of look at whether they were highly connected and integrated within the community, also the role of the environment and their role in the community as well. So it might be things that are places for collection within the community where people integrate and people socialise, and that's a real connection. So that's a real tangible point of something that can actually represent their social connectedness. So I do think that they interact quite well. So hopefully we're going to understand the difference in that social connectedness factors, and can look at how that kind of mediates the experience of solastalgia. But yeah, somebody else might have a great response.
If you want to ask a question, feel free to put your hand up, I guess. So using the hand up function, raise hand function.
Yeah, I guess also our team just kind of wanted to throw out there as well, if anyone does have any ideas about how we can kind of pull some of these constructs together. You know, it's not a closed off team, so really open to some collaborations if anyone wants to reach out.
Well, that's a lovely offer. I noticed when you're talking, it sounds like you have such an amazing array of variables and possible research questions that you can ask of the data. I'm sure this is going to keep you busy for a long time to come.
Yeah, we're definitely going to have to jump into some working groups to keep them targeted, that's for sure.
Well, it appears that you gave such a fantastic and kind of cogent overview of the project that no one had any questions to ask.
That's great. Cool.
I have a quick comment. I can't see how to raise my hand, so I'm sorry for the interruption. I can't see myself on the attendees. Lisa, I'm curious, for those of us who have not been involved in these kinds of projects, we have this sort of like pretty quick turnaround to a social crisis, and I wonder what your experience has been like in writing this kind of grant, and what advice you would hand out to others in working on this pretty large scale project that's traversing lots of different areas of expertise.
Yeah, it was definitely quite a big challenge. By the time we came through with the announcement of the actual grant, you know, we're sort of 3/4 of the way through the year before we could actually sort of get started and actually start constructing the team, getting them working together to try and pull in all these different kinds of theories and areas of research to come up with understanding some unique relationships. I think that there is so much room for growth in terms of how we can consult quicker with the community. So even though it's a bit of a delay, the piloting phase of this gave us some really critical and important feedback. And the main kind of comment that we actually get through is we really try to personalize the research, and we actually acknowledge some of the things that we're not addressing during the research. And we actually, some of the comments that we came back through with the survey is a lot of people were kind of commenting and saying, thank you for this parts of the survey, that parts of the survey. And I think that engagement is, rather than always just focusing on the research question, is that we have to acknowledge that we could actually be raising more open questions for people than we are actually closing them. So I think that those bits through the survey design were actually really quite important and made people feel closed off. When we invite people to do research, or when we open up new questions and there's kind of no closure for them in the survey about where it's actually going, kind of the next steps we can kind of contribute to that extra trauma as well, those unknowns, those efforts that they're putting in and not kind of getting back. So I think the transparency with that kind of survey was really important for us. And it kind of actually, you know, once we got people, we actually expected a little bit more drop off throughout such a long survey. You know, some people were doing it in 20 minutes, some people were doing it in 45 or longer, taking breaks. And so we actually got a higher completion rate than what we were really expecting.
It's great. It will be really interesting to hear about how the project progresses and more about the data.
Thanks, Erin.
Yeah, it does sound like a lot of the people answering your survey were really kind of, I guess, personally invested in providing and helping you with this research. And I know that obviously for lots of us, one of the main avenues to disseminate this work is through academic journals. At the same time, have you given any thought to how you might disseminate some of these findings back to the community in ways that might inform the different kind of areas that you surveyed?
Yeah, so things like the some of the first things that we want to do is to kind of pop it into more of a report style format that's accessible to the community. So contributing back to the asthma report and kind of excelling their research and contributing back to those different departments as well. So we do want the plan is to kind of reach out to them once we kind of draft some of the reports and then actually have them involved in the research output process. So that's going to be a bit of a challenge with putting it into academic journals as well, but that's a priority for this one. There's also some of them with the New Resilience Task Force and the Disaster Institutes. They've also opened up some new journals which are only about a year old and they're slightly different. So a lot of those publications come more from institutes than academics at the moment. So we want to try one and publish a few in there that sort of transition the language between traditional academic journals and those that are coming from institutes. Try and work with them as well.
That's a wonderful idea. And I want to thank you again for bringing us up to date with all the kind of exciting work that you've been doing. And I guess in lots of ways, it's kind of watch this space.
Yeah. Sure, Emily will be probably the one that'll give you a bit of an update later in the year.
Yeah, fantastic. And I'd like to thank everyone for coming along to the talk today. And I think we'll have a bit of a break with kind of the 2 weeks into, I guess, the break in the middle of the semester, and we'll see you back for the continuation of the series after that. Thanks, everyone.